Okay, the 3-hour blood work and business intensive is officially beginning. We've been chatting in the chat box for the last 10 minutes, getting to know you guys and getting to know where we need to go on today's call. So the very first thing before we dive into the blood work, we have to talk about the legal situation because depending on your background, people will tell you, oh, you don't have the licensure to read blood work. Reading blood work and ordering blood work are two very different things, okay? So let's specify the difference between the two of them. The first one, ordering blood work, you have to have a license for that. Chiropractic, DO, MD, I think naturopaths can, I'm not sure, depending on the state. But you've got to have the license to order blood work. That said, how many of you guys are familiar with lab companies like Genova Diagnostics, GI Maps, Virtual Clinic.md? There's so many out there nowadays. ZRT, Dutch Lab Tests. I mean, you name it. Okay. Life Extension's another one. Okay. All of those labs, they have an ordering physician on hand, which means you, as a health coach, as a certified functional blood work specialist, as a whatever it is, you send in your order to that lab. You're not the one ordering it. Their physician on staff is ordering it. Does that make sense? Give me a thumbs up. Okay. All right. So there's the big difference. Okay. They've all broken free of the rules because 2020 opened up the doors. Now, here's the next thing. Ordering blood work, reading blood work. So if I were to order, say I'm going to go to virtualclinic.md is the one that I always use. So it's the first one that pops in my mind. Say I send in an order form through virtualclinic.md and they have an MD, hence the why that's virtualclinic.md, because they have an MD on hand that actually orders the labs. And then my patients can then go to any LabCorp facility and get their labs drawn in any state. So I have a chiropractic license in Utah, which means I can do chiropractic and I can order labs myself in Utah. However, like I said, all of these lab companies have bypassed that rule. Okay, so thank them for helping us help our patients easier. That's ordering. Second legal concern is this. When you are reading the blood work, the way I'm going to teach you is not to diagnose. If you are reading blood work to diagnose, you need to have a license for that. If you're wanting to read blood work to actually help people and get them better and take that normal lab range and go to a smaller lab range, the functional lab range, well, you're in the right place. And two, that does not require a license. Okay, I get questions all the time, especially from chiropractors in Georgia, because for some reason Georgia doesn't want them reading blood work. Well, you're not reading blood work to diagnose. You're reading blood work to figure out what is really causing that individual, your patient, to feel like crap. Okay. List of supplying a list of these labs that I would recommend. Yeah, we'll get to that. The first hour and a half today is going to be about blood work. Well, hour and 15 minutes. It's going to be about blood work. And the number one question I get asked is, what labs should I ask my doctor for? I have a lot of people who will actually go to their primary care physician and get labs drawn there and then send them to me and I will read them, or they get on my workshops and I read them. So legal is taken care of. You guys, are we cool with that? You're really not the one ordering the labs. And two, we're not reading them to diagnose. We're reading them to figure out what the heck's wrong with our patient. Okay? Before I dive into the numbers, I want you guys to, if you want to, you can take notes. If not, you can just sit back and relax. But I'm going to be very, very apparent and upfront. I believe giving credit where credit is due. I did not come up with these ranges. A man by the name of Dr. Datis Karazian who has like 9 trillion letters next to his name. He and his team came up with them like 30 years ago. We've been using them ever since. However, that said, I have manipulated these ranges I'm going to speak to you today based upon my experience, both reading clinical labs in the clinic and the thousands of labs I've helped practitioners read. So he has made things like more complex. I like to make things very simple. Yes, Jennifer, that's the name, Datis Karazian. You guys, like you DCs, are very familiar with him. I don't know why the heck Apex Energetics dropped off the face of the earth in 2020, but I feel like they did. Anybody else feel like they did? Because I do. Okay, so once again, those are his ranges. I have manipulated them based upon my experience, and we're going to talk about those manipulations, what they are today. So when you go to when you look at labs, right, you got this stupid normal range. So for example, the TSH is, on any given lab, is 0.5 to 5.5. Would you guys agree? Tell me yes or no. In any given lab, you're going to see a TSH marker of 0.5 to 5.5. That's the normal range. Okay? Yes, it's ridiculous. I agree. We're going to take that range and make it smaller. Now, Dr. Karazian's range for TSH specifically is 1.8 to 3. I know there's a whole world out there who believes it should be like 0 to 2 and 0 to 1.5. And I like that range, but we're not talking about the thyroid lab today. I just want to explain to you, like, the way I explain this to patients is, okay, you have your normal range here. Your normal range is like trying to find your favorite restaurant somewhere between California and New York. Good luck. But if you can take it and make the functional range here, the functional range, and now you're looking for your favorite restaurant somewhere between California, somewhere within Ohio, somewhere within Sweden. Someone's on here from Sweden. That's awesome. Florida, like the ranges are much smaller, so you have more success within those tight ranges. Okay, that's how we create them. 5 very important blood work markers, and if you guys are pretty savvy, I'm going to throw in an added special and talk about a key pattern that will change the game. Here we go. We are looking at the CBC, and the key word is with differential. Okay. If you're looking at blood work and you're not seeing these 5 markers, that's because the differential portion was left off. If you are ordering labs, make sure you check the box that says the CBC with diff. That's how it's said. Okay. Very top of the CBC, as you guys all know, is the white blood cell count. The white blood cell count, the standard range, I couldn't even tell you what the normal range is, but the functional range is 5 to 8. So that white blood cell marker, if it's less than 5 or greater than 8, our patient is fighting some type of infection. Now, that is not perfect. I wish it was. It's not. If your white blood cell count, the patient you're looking at, they're sitting at, 6.8, always, always, always go down to the differential markers, which are these 5 key markers, because this one's not the greatest marker in the world. The marker where we really want to pay attention to, we're going to skip all the red blood cell counts, the platelets, all those things. Skip all those. We're going to focus on these white blood cells because the neutrophil and the next 4 markers are a component or a type of white blood cell, which is going to tell us what type of infection our patient is dealing with. Okay, that neutrophil count, the magic number is 60%. Now pay attention to the percentage markers, all right? Get inside that chat box and tell me if you guys have labs sitting next to you. Like, are you actually looking at someone's lab sitting next to you? No, too scared. You won't be scared after this. All right. A lot of you have labs. Sweet. Okay. Make sure when you're looking at labs, you are looking at the percentage markers. We don't want the absolute values. We want the percentage markers. That's it. Okay. If we have absolute values, especially in Canada, for some reason they like their absolute values up there, and we have to do a little bit of math, but I'll teach you the math. Okay. All right. The neutrophil count. If it is above 60%. Okay. So if we're looking at 66, 72, 85, whatever it is, as long as it's above 60%, you know your patient is fighting a bacterial infection. Okay? What type of bacterial infection is it? I don't know. Nor do I actually care because the treatment's the same. This is the type of bacterial infection we often call SIBO, small intestinal bacterial overgrowth. So now that $250 functional blood work breath test becomes negated. You just saved your client $250, all from the normal blood work that they already have. Now, this type of bacterial infection, I cannot tell you if it's E. coli, C. diff, Campylobacter, H. pylori, or whatever the heck else we want to call it, and it doesn't matter. Like I said, the treatment plan is the same. However, don't tell your patients this, or say it in a way that it's like, you know what, our primary care physicians in Western medicine are not trained to read blood work this way. So if you run to your doctor and you say to them, hey, I know what's wrong with my GI tract. I have a bacterial infection. They're going to laugh at them and say, no, you don't. Every test came back negative. Thank goodness those tests came back negative, because if they didn't and you got E. coli and it's positive, you might as well spend 30 days in the bathroom. Like, that's the kind of stuff. That's the difference. Okay. So bacterial infections. Now, you guys are smart. You're savvy because you're practitioners in some way, shape, or form. There is no way to determine fungal inside this specific 5 markers. However, when one infection is present, there's more. And so if I'm going to treat bacterial infections, I'm also going to treat fungal. Anybody in your office or with your clients, does anybody have a patient with reoccurring UTIs? I see some heads nodding. There you go. The problem with bacterial and antibiotics with UTIs is it only destroys the bacteria. It doesn't actually destroy the other piece of it, and that's the fungal component. Okay. Anybody else in your practice work with people who have chronic pain? Inside that chat box, let us all know. Chronic pain is especially us chiropractors. Constantly cracking backs and necks and joints, and it's like, why is this pain coming back? Well, check their labs. Okay. I had a person with, she was 32 years old at the time, so she's my age at the time, and she came in. Well, she didn't come in because I had a virtual practice. I don't know why I say that still. She went to her primary care doc. She went to chiropractor. She did massage therapy. She was doing cortisone injections into her shoulder, and nothing was helping the shoulder. They, of course, diagnosed it as frozen shoulder syndrome. And I was like, okay, well, treatment to the shoulder is not working. So did anybody take blood work along this journey of yours? And she said, yeah, I have some blood work. I'm like, all right, let's look at it. Sure enough, that neutrophil count was at 88%. Still, to this day, the highest number I've ever seen as far as the neutrophil count is concerned. I said, well, I've never been trained to think that a bacterial infection can cause frozen shoulder syndrome, but why not? This is what the blood work's telling me, so let's just treat it and find out. Sure enough, we treated it. 3 months later, her shoulder's just fine. Same with all the other joints in her body. That's starting to trickle into pain in joints everywhere. So they're like, well, maybe it's RA, maybe it's osteoarthritis, like whatever it is. Constantly throwing names out there. And nobody bothered to look at the blood work in a different way. It was ordered, because I didn't order it. Her primary care physician ordered it. And then I just looked at it through a different lens and said, okay, well, your blood work's telling me we have a bacterial infection. Let's treat it. Sure enough, her shoulder is fine. Her joint pain's gone. Her husband messages me and says, I have a wife with a stable mood again. She had 3 young kids. She had the energy back. So when I say to you, I don't read labs to diagnose, no way in shape or form would I ever have looked at that neutrophil count and said, oh, that's the reason why you have frozen shoulder syndrome. I just said, okay, this is what your labs are telling me I need to do to go from unhealthy to healthy. Let's follow the plan. And sure enough, once I helped her body get healthy, all these symptoms started to fizz away. Say yes or no if that's how easy you want your treatment plans to be, no matter who walks in the door or reaches out in a Facebook message. Okay? That's why I'm teaching you these 5 markers. Whether it be hormones, whether it be GI stuff, whatever your specialty is, these 5 markers identify underlying issues that are often overlooked. So I'll have people who are working with some hormone specialist, they listen to my podcast or they find my book or whatever it is, and they're like, oh my gosh, I knew there was more to it than hormones. I believe there's more to it than hormones. Okay. Anybody else like getting excited about this stuff? I geek out on this stuff. This is awesome. It's like, it's right there in the blood work. You just got to read it through the right lens. Okay, neutrophil count. If it's above 60%, bacterial infection, if there's a bacterial infection, I'm always going to treat fungal too. What does this look like? It looks like chronic pain in our patients. It looks like chronic fatigue in our patients. And it looks like a messed up GI tract. So all you chiropractors listening in, grab your patient's labs and see if fixing these underlying infections can make their pain resolve a lot faster, especially along with your therapy. Or if you're just like, you know what, like me, screw chiropractic, I'm going all virtual. Here you go. Here's your platform to go virtual. Okay. SIBO, and then I should add CFO as well. That fungal component right there. All right. Next up on the list is the lovely marker called lymphocyte. The lymphocyte magic number is 30%. Okay? If you're looking at labs and it is above 30%, now we're looking at some type of virus. Do I care what type of virus? Nope. There are thousands out there. This is the number 1 driver of fatigue. I don't care if it's long COVID. I don't care if it's mono, Epstein-Barr virus. I don't care what virus it is. If it's above 30%, our patients are often getting told, you know what? It's because you need to sleep more. It's because you need an SSRI, you're depressed. No, it's not. It's because their body is fighting something and it literally has no energy to do anything else. So if there's no energy to do anything else, it's going to be left with 1, fatigue, 2, depression, and then all it takes is something minor and it sets them over the edge. Anxiety. Anybody have patients who fight these things on the daily? I think if you don't, well, you need more patience then. Because everybody, fatigue is the number one complaint out there. Anxiety, depression just ramped up after 2020. This is why, because our bodies are fighting viruses and we don't even know it. But again, this is not so active that the lab test is going to come back positive. This is going to be like low activity levels, not dormant, but not so active that the test comes back positive. It's somewhere there in the middle, just enough to say, you know what? Stop trying to do all these extracurricular things. You're tired all the time. You're depressed. I'm going to mess with your brain. I'm going to mess with your nervous system. I'm going to mess with your hormones. Like these viruses, these infections, they don't play nice. They destroy any system, any organ, any gland, any tissue in the body. It's just whatever their genetic code tells them is the weakest link. How many of you have autoimmune inside your practices? More and more autoimmune showing up. Well, guess what? This is the number one trigger for autoimmune disease. Why does somebody in the same family get Hashimoto's at 47 and their daughter gets it at 17? Why does somebody in the same family get type 1 diabetes at 32 and their daughter gets it at 6? Because somewhere along the lines, the virus was active enough that it attacked the pancreas. And the pancreas stopped producing insulin. Okay. Do you guys see how this clinical application within the numbers is so cool? Because now when you sit down with a patient and you're like, I can map you, I can map out your journey, and they're looking at you like, how the heck do you know this stuff? It's all there in the numbers. You know, maybe one lab, you get 3 different sets of labs from the same person. So, one lab set was 4 years ago, the other lab set was 3 years ago, and the last lab set was a year ago. You're looking at all 3 labs and you're like, you know what? 4 years ago when you took this lab set, I bet you had a horrible week. It was one of those weeks where you could literally not even get yourself out of bed. Or you forgot to pick up the kids from kindergarten, or you were just so exhausted by the time they got home from school that you went and got takeout again because you couldn't have the energy to cook dinner. But then a year ago when you got this lab, you had a pretty good week. It was one of those weeks where it was like, I could get all this stuff done around the house and still have energy to play with the kids and read them books at night. And they fell asleep before I did. The reason why I give you that scenario is because each lab is going to be slightly different from the same person. So one lab might not uncover all of the story. The more labs you can uncover, the better. All right, Tracy, put your question in the chat box and my team will keep getting to it. We'll leave a Q&A after I'm done explaining the labs. That's the lymphocyte marker. The next marker we're going to look at are the monocytes. Magic number is 7%, and it's the same for monocytes as it is for lymphocytes. This is a viral marker. If it is above 7%, we're looking at a virus. Again, I don't know, I don't care. But here's the fun part. So I had a mom I was working with, she actually had MS, which is completely dormant now, and she quit doing those stupid 3-month trial injections, like right immediately as we started working together. I'll tell you what markers that showed up on her in just a minute. But she told me that her son, who's a great kid, kept falling asleep in class. Senior in high school, and he just couldn't keep himself awake. I said, all right, go to your doctor, get his blood drawn, and let me see what it is. Make sure you ask for a CBC with differential. Sure enough, his monocyte count was at 14%. Now, I have a personal opinion that when you get above 11, 12%, that's when Epstein-Barr virus comes back positive. So I kind of joked with her that, hey, if you were to go get Epstein-Barr virus tested, I bet it would come back positive. So she called the lab. They still had his blood. They tested it, and sure enough, his lab came back positive. Now there's a reason why he feels fatigued all the time and physically can't keep his eyes open during class. We worked on treatment plan, just fine. Now his big key is to keep that thing dormant, which is the key for all viruses. See, I told you guys, once you understand this blood work in this way, blood work no longer is terrifying. So above 7%, that's the number. All right, next up. Give me one word to define what you believe about parasites. Give me one word. I don't even know if you can do it in one word. Common, everywhere, tenacious, gut, icky, gross, pesky, yuck. There we go. You guys can do it in one word. Nice work. I don't even think I could have. Hey, well, here's your markers. Eosinophils and basophils. The magic number is 3%, and the magic number is 1%. So if any one of these two markers are elevated, we are looking at 1, allergies, so like an environmental allergies, or 2, parasite problem. Yes, I use Cellcore products. I don't believe parasites are the problem in every single person. They are a problem if these two counts are elevated. Or one of them is elevated, not necessarily both, but just one. Okay. I had what was he, like in his mid-30s? And he had seizures. He would have seizures like every 3 weeks. It was so weird. In fact, during this 1 month in practice, I accumulated 5 or 6, maybe even 7 seizure patients all in that 1 month. I approached them the exact same way I approached everybody else. What's inside the labs? And the coolest part with these seizures is that, nobody wants to get their blood drawn. But I would tell them, like, if you're in a seizure and you have an opportunity to go to the ER, go to the ER and get blood work drawn, like, in the moment, because that will tell us what's going on to trigger the seizure. And of course, they all got diagnosed with some epilepsy crap and put on medication that wasn't, I'll just shut up. Okay. So the one, he came back and his eosinophil count was like a 17%, something astronomical. I said, all right, well, let's tackle these guys. And then I start unraveling his story, and I learn that he works for the power plant. And he's actually the guy that climbs on the power lines, especially when somebody loses power. He has to climb up the power lines and put on a generator. And I'm like, oh crap. Can you find another job? But of course, not all of them can. So we worked around it. We got his body protected from all the EMFs, and as much as possible, we tackled the inside of him, the inside stuff. And I don't think his seizures are completely gone, but they're not every 3 weeks. Last I heard from his wife, it was like 1 a quarter. So I personally believe that the accumulation from this triggers the seizures. Okay, so that's the story of the eosinophil count and the basophil count. Now, go back in that chat box. We got the 5 markers. You guys understand the 5 markers? 1 to 10. I want to make sure we understand those 5 markers before we jump into like the really cool patterns. Sweet. Okay. Remember the magic numbers. Remember the magic numbers are 60, 30, 7, 3, and 1. Now, those markers, they add up to be 101. I know, I get it. But in your labs, for reals, they will always add up to be 100%. I know those magic numbers add up to be 101. It's fine. The real labs themselves will be 100%. The reason why I tell you this is because all labs must equal 100% because these are a breakdown of the white blood cell count. So it's saying, out of all the white blood cells, 60% of them are neutrophils, 27% are lymphocytes, 9% are monocytes, and 2% and 0% are eosinophils and basophils. Okay, that's how that works there. Therefore, when you see a low number, so say something is like say the lymphocyte count is 14. And you're like, well, Kylie, what does it mean if it's low? Well, I don't care about the low stuff. Because if something is low, something else must be really high. Because it has to balance out. It's got to equal 100%. And I'm going to pay attention to the really high ones. That tells me I have a bacterial infection, I have most likely a fungal infection, and clinical tip, if there's one, chances are there's more. It's just one is dominating in the blood work. There you go. There's your aha moment. Is there a workshop like this for metabolic panel, thyroid, and lipid panel? Yes, Christy, but we'll get to that later. I know. This is just 5 markers, and you're like, well, there's a whole lot other markers. What else is really inside normal blood work? I know, it's all hidden inside there. Okay, there's one pattern. Now here's the second really cool pattern. Notice the 60 and the 30. That is a 2-to-1 ratio, right? Just so you guys all know, I loved math way before I left science. I was really good at math. I was terrible at science. Yet here I am. Maybe I'm just blending the two of them together. The really cool ratio happens when these numbers start to meet in the middle. And you start to see, a 44 and a 42, a 48 and a 40. When it becomes a 1-to-1 ratio, which is the only other ratio we care about. I don't care about if it's a 3-to-1 ratio, a 4-to-1 ratio, or in that case, something is very high and it's like so dominant. We're going to treat that sucker. When it is a 1-to-1 ratio, you're dealing with autoimmune. If I could drop the mic, I would drop the mic right now. I was taught 1-to-1 was normal. I know. It is normal for them. And here's the thing. This is what I always tell clients too, because they'll say something like, well, why didn't my doctor tell me? It's not their fault. It's the fact that we are trained in a very poor way. It's the training that has failed us all. It's not the individual person. And when I approach that question with a client, I will say to them, they're not going to point something out to you if they don't know what to do about it. Because if they say to you, oh, your neutrophil count, it's at 88%, that's elevated, then your immediate question is going to be, well, what do we do about it? And if they don't know, then why would they point it out to you? So then you just get told, oh, your labs are normal. Let's adjust your thyroid medication. Here, try some PPIs, maybe try some SSRIs, whatever else we can think of. Come back in a year and let's retest. Right? Am I right, guys? So once again, I'm not blaming the person here. I'm blaming the system. The system is what has failed. The school education. Because like Teresa was saying in there, as a nurse practitioner, she's not trained to read one-to-one as an autoimmune component. She's trained to read one-to-one as normal. So now when you get that person who, these hot messes that you're like, I don't even know where to begin. You have 25 symptoms and a list of 7 diagnoses. Well, you know where to begin. You got to pull up the blood work and let the blood work walk you through that exact story. All right. We got 10 minutes for questions. So keep these questions just about the blood work we just talked about. Okay? Oh gosh. So Teresa, I'm so glad you know now. Go back and look at your mom's labs and say, oh, Mom, there's this and there's this and there's this. Let's treat it. And that way, whatever she's feeling can just start to resolve. All right, so let's look at these lab numbers so you guys can start to see how this works from another perspective, okay? So white blood cell count of 12.9, 5 to 8, that's elevated. Neutrophil count of 80, all right? That's elevated. It's above 60%. Teresa, what were her concerns? What were her symptoms?
My mom?
Yeah.
My mom's been losing chunks of time, and they can't figure out why all her testing is normal.
Chunks of what?
Her chunks of time, she will lose from this time she woke up in the afternoon and didn't remember anything from the night before.
Oh God, so memory loss.
Hours, yeah.
Okay.
And EEG is normal, everything is normal. Everything, so her LFTs, her AST and her ALT was where they were both over 400.
Oh.
And yeah,
still,
and they just kept her home. For observation, didn't do anything.
Okay, well, I'm so glad that you know what to do now.
Yeah, and I knew what I was looking at because I took your training.
Right. Yeah, so nurse practitioner.
You know what holy
cow. Okay. I've had people go on, the seizure story. She went in and the first time that she had a seizure, she was 25 years old, had a seizure completely, I don't know, a month into marriage. Wakes her husband up. She has no clue what's going on. Ended up taking her via ambulance to the doctors, and I get the blood work, and her neutrophil count was 84%. And she kept, hers weren't every 3 weeks like this other gentleman's was, but she'd go, and they were still trying to figure out, what's causing them. So she'd go to the emergency room as soon as she had one. And I said, I know you hate blood work. She's terrified of needles so much so that she'll pass out on the way to the doctor's office. So I said, but please, every time you go to the ER, do not leave without getting more blood work done. Then we started to track it. And every single time she had the seizure, her neutrophil count would be elevated. So it's okay, well, if we're going to keep this neutrophil count lower, we're going to keep you on these products. And I know it goes against everything I ever imagined when it comes to gut destruction, but it's working for you, so let's do it. And I haven't been told when she had her last episode, so we just learned that. So there you go. We've got neutrophil count elevated. You got liver problems with there. Once again, we have to be our own doctors. Teresa, does your mom do capsules? Can she swallow capsules?
Yeah. The problem is my mom
is your mom.
Doesn't do what I tell her to do. So, and I'm not her medical attorney. My computer geek sister is, so.
That's the hard part. And I'll tell you, I mean, I had a grandma. My grandparents. Okay, so 3 of my family members right now, my dad's side of the family have Parkinson's. All 3 of them. Out of 7 siblings, 3 of them have been diagnosed with Parkinson's. And it's like, I wish you'd listen to me, but you won't. So it's hard. Okay, Amanda, patient with diagnosed with autoimmune pancreatitis. Lymphocytes at 49.8 and neutrophils at 37 point, or is that hematocrit? I can't really see very. It's gotta be neutrophil count though. Okay, so with that one, Amanda, it would be autoimmune, of course, with the pancreatitis. Then you have to treat it like it's autoimmune. So you gotta calm the immune system down, revamp it, which is mostly the gut. And there you go. Viral component is the big driving force, but I wouldn't rule out the other guys. Because once again, if there's one, there's probably more. 2.8% eosinophil count. I wouldn't count that over. But again, Carla, look back in the same person's labs and see if there's another lab that shows that it was dormant or active at that time. Okay, global amnesia. Wendy, I don't really pay attention to the diagnoses. I always look at the labs. A patient coming in, so sorry, I have to leave. That's okay, Karen. You got the replay. What are eosinophils high but basophils normal? You just need to have one. So if one's elevated, then it's inclination that parasites can be a concern. Okay, why would white blood cells count? What? So that's the thing, Dr. Christie. White blood, so the difference between acute and chronic infections are high and low. I've just eliminated the acute and chronic because it gets confusing. So we're just going to say, okay, it's infection, and then run from there. Neutrophils 44 and lymphocytes 44. Hey, that's the perfect autoimmune 1-to-1 component. All right, sleeps 12 hours a day, extreme fatigue, no energy. Started after a slight cold January 3rd. All right, Virginia, I'm glad you know. Oh, these are absolute markers. Some of them are. Okay, neutrophil counts at 58%, lymphocytes at 34%, monocytes at 5%. Yeah, so nothing's really popping out with these labs. Any possibility that she's sitting in a moldy environment? Whenever there's a case with that the lab should be like glaring and they're not, I think mold.
Okay.
Is that a possibility?
Yeah. I mean, not apparent mold in her house, but it's not visible, but I'm sure if she goes digging.
Yeah.
That'd be a time that you would like indicate like a mycotoxin test to see.
Good. Mm-hmm.
Okay.
Yep. Both the eosinophils and basophils are connected with parasites to both mark. Oh yeah, we got that one. Oh yeah, just the one. Ways to treat these patients. I know. If we were to get into treatment, we'd be here for months. All right, neutrophils 65, lymphocytes 25. Yeah, I would go after the neutrophils. I mean, and like I said, if neutrophils are elevated, chances are there's more than one. And so you'll get into that. Amber, monocytes at 9. So that would be elevated. Neutrophils at 63, that's elevated. There you go. Yeah, treating family is the hardest. I just looked at my labs and I have RA. Mine are 1-to-1. Ta-da! Now you know what's causing the RA. That's the cool part about it. Go after it. Okay, patient with history of seasonal allergies, but at the time of blood work, no allergies. If eosinophils are high at 9+, does that mean it's a parasite issue? Maya, I would tackle the allergies and the parasites because the parasites might be driving the allergies. Especially if it was around that full moon time. In the case of seizures, the high neutrophil count, wouldn't that indicate bacterial infection? An infection equals inflammation, and inflammation in the brain leads to seizures. If you want to think about it like that, Teresa, yes. That could be a simple walkthrough. I've been suspicious that my mom's episodes are petite mal seizures. There you go. Nothing inside these labs, as far as I'm concerned, indicate mold. I would go after a mycotoxin test and for mold. Okay, neutrophil count of 65.9, lymphocytes of 15.4. So this is the perfect example of lymphocytes are low. I'm not paying attention to those. I'm paying attention to the ones that are elevated. That's the neutrophil count. And that would be the key for treatment there. Neutrophils 54, lymphs 37, monos 632. I would do viral on that one because of the lymphocytes. Lymphocytes are above 30%. Basals at 2. Like if there's one, chances are there's many. You won't go wrong with treating the parasites and tackling all of them at the same time. Chelsea, I'm not going to get into products. I don't honestly believe in cleanses. So I wouldn't worry about anything that's called a cleanse. But if I see lymphocytes at 33, treat for virus for this though. If they have any type of symptoms that lead to viral component, you'll never have a negative side effect. What about 3 to 1? Pay attention to the lab marker that's high. Okay. You guys, if we were to get into treatment plans right now, we're going to be here for months. So let's just focus on learning the blood work first before we worry about the treatment. Okay, so if 1 to 1 is autoimmune treat, then yeah, so then 3 to 1, the whatever marker's high is just treat the high one. We only care about the 2 to 1 ratio and the 1 to 1 ratio. Okay. I will teach you the treatment. I'm just not going to teach it to you right now. Mike is our treatment expert in here, and if he were to open up his mouth, we would all be here until midnight tonight. So we'll get into treatments later. Would you do further testing for parasite kinds? I would not. Okay, 31, 52, 12. Monocytes would be the indicator there for viral count at 12. Okay, last question, then we'll jump into. I want to bring in some special guests who will educate you on how they incorporated this into their practices. They all come from very different backgrounds. So if you're thinking like, oh my gosh, these labs are so cool, how would I implement this in something that I do? Well, I've got some cases to come. I've got some people, real life people who have done it, and they want to bring that information to you. So Denise, don't worry. I've already said virtualclinic.md is the place I would go for ordering labs. All right, guys, remember, there's a whole bunch of different labs. Okay, start with those 5 markers. Okay.